Hello and welcome all. On behalf of the NCAER National Data Innovation Center, Sonal and I would like to welcome you all to this fourth webinar in the NCAER seminar series on data collection methodology. So for today's webinar, we have a slightly different format than what we have followed in the past data talks. So today we have a panel discussion on employment decline and recovery during the pandemic. The participants in the discussion include our very own Sonal, Professor Sonalde Desai from NCAER and the University of Maryland, Professor Ankur Sarin from Indian Institute of Management, Ahmedabad, Dr. Rahul Lahoti from ETH Zurich and also from Azim Premji University, and Dr. Kaushik Krishnan from the Center for Monitoring Indian Economy. So Dr. Pranab Sen, the country director of International Growth Center, was supposed to chair the discussion, but unfortunately, for a family emergency, he won't be able to join today. So it's our loss that we won't be able to, he won't be able to attend today's discussion. So let me do the job of introducing all our panelists today. So we'll start today's discussion, today's proceedings with Professor Desai. So Professor Desai is a distinguished university professor at the University of Maryland and professor at NCAER, and also the director of NCAER's National Data Innovation Center. She is a demographer whose work deals primarily with social inequalities in developing countries, focusing on gender and class inequalities in human development. She leads the India Human Development Survey and has been elected as the president of the Population Association of America for 2022. So after Sonal, we'll have Professor Sarin as our next speaker. So Professor Sarin is an associate professor at the Indian Institute of Management, Ahmedabad. A shared theme in his research is attention to the consequences of inequalities and instruments used to counter them. These include public policies, social enterprises, and movements. In his recent work, he has tried to use field-based research to study and facilitate the fulfillment of policy obligations to citizens, especially children. He holds a PhD in public policy from the Harris School of Public Policy, University of Chicago, and a BA in economics from Bates College. Our next speaker for today's panel discussion is Dr. Lahoti. He is a researcher at ETH Zurich and faculty fellow at Center for Sustainable Employment, Azim Premji University. His research focuses on gender, labor markets, poverty, and inequality. He was involved in 3 phone surveys during the pandemic and has analyzed secondary data to understand the distributional impacts of the pandemic on employment and income. He holds a PhD from the University of Göttingen, Germany, and a master's in public administration from Columbia University, New York. Our next speaker is Dr. Kaushik Krishnan. Dr. Krishnan works in the Household Survey Division of CMIE. His primary responsibility is to deliver record-level data from the Consumer Pyramids Household Survey to researchers. He holds an LLM and a PhD in economics from University of California, Berkeley. So I'd request all the speakers to complete their presentation within 10 minutes. So I'd request Sonal to start the proceedings, and Sonal will have an additional 5 minutes, I guess, to give an overview of all the 4 surveys that we'll be talking today. So without further ado, I'd request Sonal to start the proceedings.
Thank you, Santanu. You know, one of the reasons to sort of start out with what I'm going to do is just to say that I think we are in a situation where every piece of information we collect is suspect in some ways because collecting data is difficult, Measurement of some of the concepts that we are trying to collect are difficult because sometimes you end up doing surveys in person, sometimes on phone.
Yes, already.
Approaching the individuals that we want to interview is also quite difficult. So one of the things I want to start out by saying is that as a data collector, I'd like to say that there is nothing that like data collection to teach us humility. Okay? In that sort of spirit, what I want to do is go through the 4 data sets that we are going to be presenting to you and give you just a very brief highlight. All the information that I'm going to talk about has been given to me by today's panelists. But just so that we know how to set the stage with respect to interpreting all the results that are going to be presented. Couple of things we all have to remember. First, data collection in pandemics is difficult. Second, results are highly sensitive to the definition of employment that we use. Often there is a difference between what we think we are trying to collect and what our respondents understand what we are trying to ask them. There is also a difference in the impact of the pandemic by geographies that we are studying and socioeconomic backgrounds that we are looking at. And yet, I think that we have very interesting presentations, which each helps us sort of paint the picture of the employment during pandemic, that if we take together, we may be able to make some sort of a sense out of what we are seeing. So what are we going to see? Okay, now, the slide that I'm sort of showing starts out with PLFS as the primary data source against which sort of we are comparing many of the results, or at least the distribution of the samples. The 4 surveys that we will be presenting is 1, I will be talking about our Delhi Metropolitan Area Study telephone survey. Ankur Sarin is going to be talking about an interesting survey called RCRC survey, which he has done in collaboration with several grassroots working NGOs. So he can add depth to what we wouldn't be able to do. Then Rahul Lahoti is going to talk about the Azim Premji University Working India survey. And Kaushik Krishnan will talk about the CMIE panel that we all know quite a bit about. The goal of each of these data collection was different. For us, it was about the validation of data collection methods, which is what we started in 2019. And when the pandemic struck, we decided, well, we would continue to collect this data. Ours was a monthly interview survey, a monthly telephone interview. And so we just decided to continue it. Ankur Sarin began his survey during the pandemic in response to some of the rural distress that was being seen. And his data covers 15 states, whereas the one I'll be presenting only covers Delhi National Capital Region. Rahul Lahoti is going to talk about Karnataka and Rajasthan, plus some of the other data collection that he has been doing. Whereas the CMI panel is a nationwide panel with an extremely large sample. The big difference, however, between these surveys is in terms of a little bit in terms of sample composition, in that the survey that NCER data that I'll be presenting has 50% urban and 50% rural. Ankur Sarin is fully rural. Rahul Lahoti's survey has about 17% urban sample, and the CMI data has about 65% that is urban, or 64% that is urban, unweighted. Okay. Similarly, there is a difference in education level between the 4 panels. Whereas the illiteracy presented in PLFS is about 21%. The data that I'm going to present to you, which is going to be very Delhi biased, has only 12% people who are illiterate. The Rahul Lahoti survey is 31% respondents who are illiterate. And the CMI has the extremely small percentage, which is illiterate, about 1.8%. So that's somewhat of a kind of a scale or differences that we'll be talking about. The questions that each of us ask with respect to employment also differ. PLFS collects data on current weekly activity status. The data that NCER survey has collected contains questions about, it was designed to collect data on, better data on women's employment, and hence it contains questions about, does your household own farm? Did you work on the farm? And so on. The RCRC survey talks about what is the primary occupation of the household. IWS survey, India Working Survey, talks about current weekly activity by asking respondents to respond to a series of binary activity-based questions, probably very similar to the NCER approach. And a CPHS basically focuses on the nature of the occupation of individual, followed by whether they are employed or unemployed, and uses the pay or profit concept, which has been explained to interviewers for conversational interview. As a result, the labor force participation rate pre-pandemic differs significantly across these surveys, particularly with respect to female employment rates. Whereas PLFS in the latest round seems to be showing 29% of the Indian women being employed. The NCER DMAS survey shows 36% being employed. The India Working Survey shows 58% of the women who are employed, whereas CPHS has close to 10% female employment rate. So in that sense, each of these surveys sort of show a different segment of the population in some ways. And our goal would be to sort of put it together to come up with some sort of a cohesive story. So let me sort of get on to the data that I know best. Delhi Metropolitan Area study in the telephone survey part of that particular study. This was work that was carried out by NCER National Data Innovation Center, and actually three of my colleagues who were deeply involved in this data collection, Neeraj Deshmukh, Santanu Pramanik, and Dinesh Tiwari are all on the Zoom call right now. In 2019 January, we started out an experiment to see if we can improve the measurement of women's work, because we sort of felt that the NSS data that was consistently showing a decline in women's labor force participation might be missing out something. So what we did was we first started out with a baseline survey where individuals were asked the NSS type question about their primary activity status and secondary activity status. And then we went into more detailed questions to see if we were able to capture a greater proportion of female employment. After that, our goal was to continue a monthly telephone survey where, after validating this questionnaire, we thought we would continue a monthly telephone survey where selected household members would be asked a very short module of less than 5 minutes long. So the sample size was about 2,100 men and women at the start of the data collection. Sample is located totally in Delhi NCR region, including Delhi, Haryana, UP, and Rajasthan. So typical questions about employment would ask, what is your primary activity status? And for people who are involved in domestic duties, the question would be, what other activities did you engage in for a period of at least 30 days? Instead, what we did was we asked, does your household have a farm? Did you participate? Did you work on the farm? Does your household have a livestock? Did you work on taking care of the livestock, and so on? And as a result, the labor force participation rate for women that we capture is much higher. For men, the difference is not very much. So then what happened was that the pandemic struck, and our original goal was to do 12 monthly telephone surveys, which would have ended in March of 2020. We decided after a short break that we were going to continue doing the telephone surveys because we already had a telephone survey system in place with individuals who had first been interviewed through a face-to-face survey, and we had quite a bit of household information for that. So those surveys have been continuing, and the results based on this provide a very interesting picture. What I'm presenting right now is the work participation rate between March 2019 and September 2021 for men and women. And as you can see, there was a sharp decline in work participation during the first lockdown between March, April, and May of 2020. And then there was sort of a gradual recovery. The drop in employment that occurred with the second wave of COVID in March and in April and May of this year was not as sharp as the first lockdown. And again, it has been sort of going through a gradual recovery. This in itself is an interesting story, but a lot kind of lies behind it. And that's what I would like to talk about for a few minutes. Specifically, because our monthly surveys were not consistently done for each individual, sometimes people were busy, sometimes their phones didn't work. We have some missing data, and as a result, what we are doing here is doing multivariate analysis that controls for a variety of factors in a model that is often known as random effects model, where individual specific random effects are controlled. And we control for household asset ownership, place of residence, education, and month of interview in order to address seasonality. What the results show is pretty similar to what I just showed you, which is that there was a sharp drop in the work participation rate for both men and women. Please remember that when you look at these graphs, the scale on which women's data are presented is different from that for men. And so overall decline for men was larger than for women just because they started from a much higher base. But for both men and women, there was an immediate drop in work participation following the first lockdown, which gradually recovered. There was a smaller drop during April and June, and again, there is a gradual recovery. However, once we divide up the work that men and women are doing in wage work versus self-employment, what we find is that the decline in wage work was much sharper and the recovery has been much smaller. The decline in wage work was particularly large for women, and women's post-pandemic recovery, even as recently as August, September of this year, is nowhere near close to what it was during before the pandemic. Predicted margins for women's wage work in pre-COVID era are roughly about 0.13, whereas now it's close to 0.09. So wage work impacts remain very substantial. What has protected people is an ability to participate in farm work and in petty businesses. And these are the areas where both decline was smaller to begin with and recovery has been sharper. Partly because being able to do wage work depends on your employer. Being able to work on your as a self-employed, particularly in your family farm, it's very easy to go back to the work. And even in petty businesses, a lot of people seem to be restarting with that. So in some sense, self-employment has emerged as sort of a protective force during this period of pandemic, whereas wage employment has shown substantial recovery. Unfortunately, incomes from wage employment, particularly salaried work, are much higher than those from self-employment. And so the income decline may be sharper than what we are picking up just looking at the employment decline and recovery. We also find that this is one area in which urban residents have been affected far more sharply than rural residents. And the urban, not surprising because wage work is far more predominant in urban areas, whereas self-employment is far more predominant in rural areas. And the government decline that took place as part of both the first and second wave of pandemic is in urban areas still not showing full recovery, particularly for men. We also find that whereas everybody was affected the lockdown and employment decline, recovery has been faster for people among the highest asset quintile or the richest people, the most educated people. partially because many of them are in jobs that are a little more protected. With that, before Santanu stops me, I'm going to end and just tell you that in some sense, what are the lessons of the results I presented for future data collection and policy? First, we just have to remember that in informal economy, people find whatever work they can. Often they return to family farming or start some petty business, but that does not necessarily mean high income. So judging the recovery by number of people employed is reasonable, but might not tell the full story. And I'm hoping Ankur will be able to tell some more of that story. I also think that data collection on employment needs to do a better job of capturing various types of employment, including self-employment. Now, the biggest, I'm keenly aware that there are parts of the story that we have missed out. And I'm very glad that Ankur Sarin is going to go follow me, because one of the biggest drawbacks of our work is that we started this data collection 1 year before the pandemic, interviewing respondents on a monthly level, which meant that we have a lot of stable residents of the area. And we might have missed out the most vulnerable people, the temporary migrants into cities and families to whom they return. So over to you, Ankur, to fill in the story where I am missing out. Thank you.
Bye. Thank you, Professor. I think we do engage in some form or the other, but our survey, as you know, was not directly connected to employment or unemployment in particular. And the survey that I'm presenting is one that the collective RCRC has done. And I'm really speaking here as an outsider, but with an insider view on what has been done and sort of a regular conversation and engagement that I've had with them. And all credit for this survey really should go to the RCRC research team. But going forward, we do have plans to sort of build on what has been done. And I'm hoping, and I know I am going to learn a whole lot more. And I'm hoping I'm going to get many more suggestions and comments about what we should be doing. The plan is that we would be pursuing a panel of households in rural India every 3 months. And if I have a little bit of time, I'll also share what our future plans are, and hopefully we can get some suggestions. But for now, I'm going to try to maybe engage with what we have found more or less so far. So the whole exercise really needs to be seen as an experiment in research. Because the research per se was not initiated by the typical folk, which what I mean is by people like us who sort of say, hey, these are the questions we're interested in. The research was initiated by this coalition of 65 plus organizations working in rural India, predominantly in the livelihood space. And when the pandemic hit, they said, well, we still have our people on the ground, and we want to know what's happening among the people that are served, among the people that we work with. So this was really initiated by them, and as it says, the mission is to generate real-time evidence. And 3 rounds of surveys have been done between 11,000.
Professor Sarin, sorry to interrupt you. So have you shared your screen? We can't really see your screen.
It's saying your screen sharing now. Which screen has been shared? That's the. Because I'm in a room where they've given me multiple screens. Are you seeing my presentation now?
We can't see your presentation. It just says that Sarin has started sharing.
That's strange. Let me see if I can fix this. Are you seeing the presentation now?
No, it's the same message we are getting.
Rahul, do you want to start?
Yeah. Can you see my screen?
Yes.
Okay, so what I'll be presenting today is challenges and lessons from measuring employment and incomes during the pandemic. I will first sort of talk about some data collection exercises which we did, and talk about results from one particular exercise, but focus a little bit of more of my energy in trying to think through the past 18 months and seeing what were the challenges and what were some lessons learned and way ahead. And some of this is also the surveys which I'll talk about today are somewhat similar in methodology to what Sonal talked about. And so it would also be good. So there were two data collection efforts which we did. One was Azim Premji University Livelihoods phone survey. This was done by the Center of Sustainable Employment at Azim Premji University. We did 2 rounds of phone surveys, one just after the first lockdown and the second in October, December. This was in around 10 states with the help of CSOs. And the second survey is the India Working Survey, which is a joint effort by Azim Premji University, IIM Bangalore, and University of Western Australia. This survey was designed before the pandemic, and one of its intentions was to figure out how measurement techniques impact employment statistics. And but we were in the field in February, March. We had to sort of cut short our field work, and so our sample is also, as mentioned earlier, is a little rural bias because initially we had finished a rural sample more. But we did a phone survey of these respondents in August, September, and I'll talk about those. So we interviewed 300 individuals in August, September. Basically, in each household, we randomly selected 1 male and 1 female, which was selected in February, March. And we talked with those individuals. And these households are randomly selected. Instead of the typical single employment status question, we basically ask a series of binary questions like, did you do any wage work last week? Did you do any self-employment work? Did you take care of livestock? Similar to questions in the earlier survey. And in addition, instead of using proxy responses, we only talked to these two respondents and asked about their own labor market participation. And so all these responses are self-responses. We also, we had a module where we tested whether self versus proxy matters. So what do we find? What we find is that employment status is that overall labor force participation recovered by September 2020 for our sample. Actually, there was a distress employment. So what you will find is that if you look at out of labor force has declined. The field survey is the February-March survey, and the phone survey is the later one. And so out of labor force declined, and we had additional questions which basically helped us understand that most of the people who were joining the labor force, who were earlier out of the labor force, were more than 50% were out of distress, where household incomes had declined. You'll also find that unemployment for women is higher in our sample as compared that to men. So it's around 21%. And both men and women's labor force participation has increased. But what these aggregates hide are a lot of fluctuations which are happening in the labor market underneath, because the aggregates look sort of towards a complete recovery. But if you look at people who were working before the pandemic and before the lockdown, you'll find that only 50% of women had jobs in September 2020. Because what has happened is that women who were working have moved out of the labor force, and they have been replaced by other women who were out of the who were previously out of the labor force. And so those type of transitions have happened particularly more for women. The second type of you'll find here, what happens is, if you look at pre-pandemic, which is Feb-March 2020 to post first lockdown, you'll find that so men who were out of the labor force before, around 68% are now in the workforce, so they have jobs. and very few of workforce have moved out of the labor force. For women, what has happened is something similar in terms of 33% to a lower extent, 34% have who were out of labor force in Feb March have come in the labor force, and but also who were part of the labor force, workforce, or unemployed, they have moved out of the labor force, which is slightly less for men. And so, so at the individual level, there have been a lot of fluctuations which are going on. The other fluctuation, as Sonal mentioned earlier, was that non-agriculture workforce has been severely affected, particularly if you look at women and non-agriculture work. So these are all men and women who were working before the pandemic hit. So among women who were working in non-agriculture sector, 60% remained in the workforce. About 22% left the labor force, and around 18% were unemployed. For men also, it's something similar, but on a far lower level in terms of moving out of the labor force is not as substantive as for women, particularly for non-ag. The other thing was that our sample is rural. Even then, in the rural sample, we find that people have moved into agriculture. So agriculture has acted as a fallback mechanism. So you will find that people who earlier, so this is looking at people who are working in both the periods and sectors for them. So if you look at agriculture and mining, which is mostly agriculture, 90%, 92% stayed in that, but a lot of people from manufacturing, construction, and services entered the agriculture sector. So you'll find that for manufacturing, only 47% remained in manufacturing. For construction, only 40% remained, but others moved. And most of the fallback was towards agriculture. The last point is somewhat similar to the Delhi results, is that people moved from, so if you look at regular wage and casual wage work, so this is pre-pandemic, this is own account worker, which is self-employment with no employees and with employees and unpaid helpers, and regular wage and casual. You'll find that people have, there's a lot of transitions. Even in own account workers, only 55% stayed as own account workers. But you'll find that a lot of own account workers with employees moved into own account workers, which is basically they shrank, did not have any employees. A lot of regular wage and casual wage moved into self-employment. So broadly, if you define self-employment as these first three categories, so there was a lot of movement into these categories. 60% of wage workers in our sample remained as wage workers, and around 41% remained, but others moved quite a bit. So the story is basically that overall the statistics look, employment statistics look stable in terms of recovery, but lot of internal movement has happened. The second thing, which is quite interesting, is that if you look at wages, so we collected, not wages, incomes, we collected income information, and both before and after the pandemic hit, and we find that share of zero incomes substantively rises. So this is pre-pandemic, almost all salaried employees have reported some incomes, but around 42% of salaried employees reported zero incomes in August, September 2020, where they said that they are working in wage work. And this is not just the case with IWS, but this is also the case with PLFS, where the number of zeros have substantively increased, people reporting zero incomes. And this is an interesting puzzle in terms of how do you, so these averages are mean income averages are calculated without the zeros. But if you calculate them with the zeros, you will find a substantive drop in wage income levels. And how do you treat them is not very clear, whether they are employed, they are earning zero, whether it's just a transition. So they are somewhere in the middle. Now I'd like to move on to some of the challenges and lessons that we did from all these three phone survey exercises which we did. As Sonal said before, these exercises were very difficult, but I think very critical to understand what was happening. So some of the challenges are that there are sampling problems. So one of our surveys is a purposive survey. The other one happens to be a random survey because we had an earlier sample. So the purposive survey problems always persist that it's a very select sample, and how much can you extrapolate from that. Length of the survey between 15 to 30 minutes at max, and you're stretching it if you go close to 30 minutes. Response rates are lower in phone surveys. Our attrition numbers were decent for this survey, around 70% response rates from the earlier Feb panel. Privacy is a big issue, especially for women respondents. Privacy is generally issued with surveys, but in phone surveys, we found in various instances there's mother-in-law or somebody else listening in and giving the answers from behind, and so maintaining privacy is it's quite difficult. Quality of data, hence quality of data due to privacy or other issues is also a question mark. Whether we provide incentives because you are doing phone survey and the expectation is different in a phone survey versus a field survey. Enumerator training monitoring was difficult both due to the pandemic as well as everything being online. There's now now sort of our second rounds, we found that there was a phone survey fatigue which has creeped in because there have been a lot of phone surveys earlier. But we learned a lot of lessons in these challenges. There is a lot of tools which can be used to paradata and real-time data, or tools which can help enumerator monitoring as well as checking the quality of data, checking whether there was background noise, and trying to do those. There is a lot of detailed protocol which can be made so that you can analyze and figure out what the times are and increase your response rates. Piloting is easier in phone surveys as compared to field surveys. Phone surveys are obviously faster and cheaper, but all these other problems do remain. There's issues with interpretation of the results. As earlier mentioned, wording of the employment question matters a lot. And in the pandemic specifically, reference period is very important because week to week, there is a lot of fluctuation. So whether you ask a week, whether you ask a week as well as a month, that is critical. Then several surveys did not ask income questions, which we felt was important because if employment has returned, but if you don't have income, then what does it actually mean? Many individuals that are like the zero income problem where how do you count them as employed without incomes? And finally, to conclude, as in data collection in the first pandemic, first after the first lockdown was, there were a lot of surveys. The Center for Sustainable Employment at APU maintains a list. There are 90 such surveys. Most of them though are in the first wave. And so we know a little only from a few surveys about the second wave. Even though most surveys were purposive initially, they collectively offer quite a glimpse of the level of distress. And like it or not, phone surveys are sort of here to stay and we'll have to adapt to that. Even though all these exercises are very, you can question all these exercises, but data is critical, and I think common lessons learned from them can help. And as in at least in the two presentations till now, story is not very substantively different. So at least that that validates that there is something, some common thing around that. Thanks.
Thank you so much, Rahul. And next, I'd request Professor Sarin to share his presentation. So, Sonal, if you can share the presentation.
I think Rahul might have to stop sharing.
Yeah, I have stopped sharing.
Sorry, Sonu, can you share it now?
Yes.
Great.
Yeah.
Thank you. Yeah, we can move ahead. So as I mentioned, this is really sort of an experiment where the organizations that typically work on the ground, implementing programs, are actually collecting the data themselves with the questions that they have. And the kind of engagement that they're looking for is not only at, say, the national level or at the, the center, but also at the state, the local level, as well as taking it back to the community. And whilst, you'll see in the way that the questions have been asked and, the kind of data we don't have the kind of systematic data that we've seen with the first two presentations. But what we are hoping to do now going forward is to have data collected as systematically as some of the other surveys that we have seen. And when I say systematically, both in terms of, who comes into our sample, as well as how the questions are framed. If you could go ahead, Son. So yes, there have been 3 rounds, and what we pick up, it's entirely purposive. There is no, although there was an effort to sort of do this randomly, but it's a large number of organizations working across a very, very diverse range of geographies. And we will not claim by any means that this was actually done randomly. So we should assume it is entirely purposive. But even given that it is purposive, while in a statistical sense, it doesn't. But if you look at the numbers, it definitely represents a population which is much more vulnerable than typically captured. So for instance, we have Adivasis, so STs, constituting nearly 30 to 40% of the sample across the rounds. The survey, the focus was on these measures of food security, livelihood, because it was more saying, well, how do we respond? How do the organizations respond? What is the best way to respond, right? So we were able to, not, again, we don't have a sample which is representative at the block level or an adequate number, but we were able to cover nearly 125 to 169 blocks. If you could go ahead. So this was the original plan that each organization was told 5 villages per block, 2 blocks per district, 100 respondents per block, and every 5th household selected across all hamlets. Was this process followed? Most likely not. From whatever we've been given to understand, that it was not. And there are several reasons to it. Many of the organizations, for them, this was the first time they were doing this kind of data collection. This was supposed to be, in some sense, rapid surveys. So there was limited time for training, piloting. There was very little quality control because this is being done with a very, lean group of people. And with very lean resources in some ways, and entirely voluntary, right? The organizations volunteered to do it. And again, these were people who were predominantly working with the NGOs to start with. In the most recent round, the one that was done in December 2020, we did try to reach out to those that the organizations don't typically work with, right? Now, one of the things that the RCRC organizations were keen to do was to get some representation of female respondents. Now, what this translated to was that the survey was conducted from the female respondent, but it was still a household survey. So does it really change things in terms of, in terms of the answers that we are seeing? Probably not. So we have to look at more carefully in terms of which questions were specifically targeted at women and which were specifically targeted at men. So this is, again, just a broad overview. As I said, more representative of vulnerable populations. Just to point out, now when we asked this question in July, that what is, is your monthly income less than 5,000? And 82% your current income, right? 82% said that it is. Now, we asked a different question in December 2020 because we were trying to get some before after. So the 55%, so the 55% of the households said that the monthly income in 2019 used to be less than 5K. But in December, 74% were saying that, right? Which is less than what was the percentage that reported that in July. But you can see the difference between pre and post COVID in terms of at least asking this question retrospectively. Yeah, we can go ahead. So these are the states or the or the districts from which the sample was collected. We can go ahead. So these are some overall findings that we thought would be useful to share. These are findings from the most recent survey conducted between December 20 and Jan 21. Approximately 70% households reported loss in income to the question, has income reduced due to COVID, right? And it is highest amongst those with migrants. And as we see as we go down the slide, in every single indicator, migrant households, so households which said that they do have a migrant as part of the household, their indicators are worse off. So around 20% reported loss of job during the pandemic. So the question was, has anyone in the family lost a job because of COVID? Higher among migrant households. In December, which is nearly now 8 months since the lockdown, 25% continue to say that they have continued to cut down on food, which is a staggering number in some sense. A quarter of the sample is telling us that. And again, higher for households with migrant, 30% for seeking loan, 57% among those who had returned to the village had gone back by December. And then 60% of those who were still there wished to go back, among those who were still there, right? One of the things that the survey was trying to focus on was the access to government policies. So with NREGA, for instance, we find that around 32% tried work, but only 56% among those who tried actually got it. And against migrants, more likely to try, but less likely to actually get. So the particular vulnerability that migrant households face, as Professor Desai was also mentioning, we definitely see that represented in the data that we have. If you could go ahead. Now, one of the things that we tried to do was go beyond the data and try to say, okay, well, let's take this data back to the organizations that have collected the data, the enumerators who've been on the field, and ask them to explain some of this to us. So we found, for instance, a lack of demand for NREGA in Bihar. Now, why was that the case? In Bihar, the story was predominantly of saying people were selective as to whether they wanted to do NREGA work. So those who had, quote unquote, been working with skills, they were not willing to get into NREGA or demand NREGA. In Gujarat, the story was different. It was not about skills. It was not about previous occupations. It was more about these in some sense, administrative processes which can be sorted out. So, there was a lack of sort of, individual work and the government did not want to initiate group work due to COVID. So, and then of course the whole question with delay of payments and what we heard often was the NGO saying that people are willing to work at a lower wage if they get it instantly rather than having to wait. And also we found a substantial amount of variation across the districts. So if we have to understand these stories, it was very clear that we need to go even more granular. And so in the next round of surveys that we are trying to do, we're trying to make sure that we have a sample of 300 households randomly sampled for the block. And we are going to cover 20 villages and 15 households per village. So we are hoping we would have, quote unquote, a representative sample at the block level, and we will be able to look at these stories at the level of the block. Yeah, if you could go ahead. So I have a few, in some ways, these are our lessons that we learned. How we were asking our questions, what did not work, and what it means for the future. I'll skip that, but I'll just get to some of the concerns. Perhaps, one is the issue of quality, as Rahul mentioned. These are all face-to-face surveys, but despite that, there is this question that, okay, these are people who work in these villages, in these communities, typically as community workers, as NGO workers. What kind of a response bias gets created because of that, right? That's a question. And, from the questions that we have asked, we've not been able to figure out which direction, if there is a bias, which direction there is. Because on the one hand, you might expect households to, in anticipation of, services, etc., they may, overrepresent their distress. On the other hand, because these are people, the enumerators are people who are from the community, some ways known to the community, they're also less likely to misrepresent the distress. So that is something that we are, we have to think about. We definitely have to figure out a way to, get the questions right in the languages that are being asked. Make sure that the interpretations are right. So a lot more effort needs to be done piloting these questions, which honestly was not done and not even possible really in the way that we were trying to do. So this is at end here saying that this is more forward-looking, but I think there are still fairly interesting insights that do have emerged. And what is, just to conclude, I mean, what is perhaps most remarkable is that organizations have already used this data for various efforts. So they've gone and, when realizing when NREGA work is low, realizing where there's a need to access loans, where the Jan Dhan Yojana was not reaching, they actually responded in terms of program activity. So you see a much quicker impact from this research and from this data collection exercise. So I'll stop then and be happy to take more questions later. Thank you.
Thank you, Professor Sarin. So now we turn to our last speaker in today's panel discussion, Dr. Kaushik Krishnan.
Thank you so much, Santanu. And thank you to both you and Sonal for inviting us. Are you able to hear me and see me all right?
Yes.
Okay. Yes. Great. Let me try and share my screen. Can you see me in full screen as well?
Yes.
Okay, wonderful. Thank you again for inviting us. This is really just an amazing opportunity for us to learn. As Sonal said in the beginning, and as we could see in Sonal's presentation, in Rahul's presentation, in Ankur's presentation, despite all of these differences in the surveys, in the methodologies, in what we're after, there's so much that seems to come out, even from our own experiences that seem to be common. Movement of employment into agriculture due to the lockdown, casual workers getting hit, incomes falling, zero incomes, the importance of migrants. These are all themes that resonate with us, as do the themes about survey execution, the importance of paradata and checking, as Rahul said, the importance of languages, definitions, as both Sonal and Ankur said. So it is really amazing how much common ground there is, despite how different these surveys are in many ways. But I'll take you through what we at CPHS have done. Just as a quick introduction to CPHS, CPHS is an all-India household survey of a panel of sample households designed to capture fast frequency measures of household well-being. So when we say a panel, and fast frequency panel at that, we've conducted 23 rounds of data collection already. We're in the 24th round. We started on the 1st of January 2014. We do 3 rounds of data collection every year. We've not missed a single round in the field. And we're in the 24th round, which is the end of this year. That will finish on the 31st of December. We have a large sample of households spread across the country. Our sample is 178,677 households. It's an all-India sample. We cover the landmass of India that contributes 99% of India's population as of the 2011 census. There are some small areas that are missing, for example, the Andaman and Nicobar Islands, certain portions of the Northeast, Ladakh, etc. But if you add them all up together, they account for less than 1% or about 1% of India's population. The survey is also large. We capture many, many measures of well-being. We capture 635 indicators on these households and the members inside these households every time we conduct the survey. And in particular, we managed to have nearly uninterrupted data collection through the lockdowns, which is perhaps why there's been an explosion of work using our data. We are really producers of the data. We put the data out there for others to research and analyze. When we moved into the lockdown, we switched from in-person surveying to phone surveying, switched back into in-person surveying where possible. We've talked about this in other fora, so I won't go into it in much detail here. As of September, which is the month that just ended, we are over 99% of accepted interviews being conducted in person, and we are looking forward to keeping that momentum going. I tell you just very briefly about the 635 indicators because it's not the subject of this talk, but just as an introduction to CPHS. We capture a variety of information on both member level characteristics as well as household level characteristics, everything from health to time use to financial inclusion to income to consumption expenditure, household amenities, savings, borrowings, assets, etc. Today, I will not talk to you about any of those things. I'll just focus on employment. Even in employment, we capture a lot. The place that you work in, the kind of work that you do, both in terms of whether it's salaried work or casual work or self-employed work, whether it's full-time, part-time, your occupation, your industry. But again, today I'll talk to you about just one of these indicators, which is employment status. So let me just give you the headline findings that we see from CPHS when it comes to employment. The surprise is, or the lack of surprise is that we see something very similar to what all of these other surveys have seen, which really lends some credence to the story that's come out of these last 18 months. So if you look at unemployment rate, all the way from 2017 to March, there was a steady rise going from about 4% in 2017 to about 8.8% in March of 2020. That's pre-pandemic. Now, all of that changed, as we know. In April, it shot up the unemployment rate. It went up to 23.5%. And our hearts were collectively in our mouths, waiting to see how that would change as time went on. Luckily, by July, things had started to get better, at least as measured by the unemployment rate. This doesn't take away from the very important point that Sonal made, which is what is the right measure to use? But using this one measure called unemployment rate that fell from 23.5% in April down to about 7.4% in July of 2020. And we thought, okay, there's a silver lining. And as time has progressed, we've seen that this progression has been quite choppy. In the second lockdown in 2021, this year, unemployment rate went up again at 11.8%. And as of September 2021, the month that's just over, it was 6.9%. So it's been choppy. And in many ways, this is the new normal. As Sonal said, there are many measures of what is the right way to look at the health of the labor force. One way, of course, is the unemployment rate. Another way is the employment rate. Just to show you what happened there, the story is similar, but there are some interesting and important nuances. Pre-pandemic, all the way from October 2016 till March of 2020, or January of 2020, just before the lockdowns and the pandemic, there was a steady fall in the employment rate according to CPHS in India. And just like with the unemployment rate, we saw this steep drop in April, falling down to 27%, and then a sharp recovery by July up to 37%, not back up to where it was in January 2020. And then, much like the unemployment rate as well, the employment rate kind of stayed there with the little blip that happened in the second lockdowns. It has been stagnant until at least September 2021, and it's currently at 37.9%. So again, in a way, this is the new normal. We see the employment rate stagnant at 38%, not too far, but still lower from where it was just before the pandemics and the lockdown. And really to strongly echo the point that Sonal had made, but also the points that come out so clearly in the work that both Rahul showed as well as Ankur showed, there are so many facets to trying to understand how healthy the labor market really is. And the way in which you cut and slice the data makes a big difference to the stories that you can take away. Let's just look at the employment rate, just one story to try and illustrate that. There are devils in each of these numbers, in the details of each of these numbers. If you look at for 20 to 24-year-olds, for the quarters ending in September, both for 2018 and 2019, the employment rates were about 27% or 26%. These are people who are probably entering the labor force around this age. Even though the aggregate employment rate for 20 and 2021 as well, were nearing the kind of employment rates that we saw pre-pandemic. If you just look at this age group, the 20 to 24-year-olds, you see a remarkably different story. Instead of it being in the 27s, it's 22%. And then for the quarter ending in September of this year, it was 20%. So you can see compositionally, there are interesting things that we need to pay attention to that are happening in India's economy. A lot of it is being studied. Some part of that is being studied using CPHS, and we're really grateful that this is being done. Rahul's colleagues, I know Ankur's colleagues in IMA, as well as Sonal and some colleagues in NCAER are using our data to also unpack other stories, and we're really happy to see those stories come out, as well as seeing those stories kind of being validated against what other surveys are also saying. I'll move now quickly because the time is limited and there are so many results, but I'll focus now on the reflections. And Sonal asked all of us a very interesting and provocative question. The question was, what does our data collection experience over the past 18 months tell us about enhancing future data collection strategies? For us, the answer is a little different perhaps than some of the other answers that we've seen. It's really a focus on themes. There were two themes in particular that the pandemic and the lockdowns have told us that we need to focus on more. One of those themes is migration. Another of those themes is health. We were already doing some work on migration, some work on health. Our migration module has substantially been revamped, is much more detailed, much more information both on in-migration into households as well as out-migration out of households, reasons for migration, the locations of migration, because we see that this is really important data that needs to be collected. Equally on health, we were asking three important questions that we still think are very important. Is this member healthy? Is this member on regular medication? Is this member hospitalized? But on top of that, we see now that there is a real need for us to expand our work on health. And so we internally in CPHS are thinking a lot about health and are doing a lot of work internally in trying to figure out how we can supplement and add to our data collection on health. And we hope that in the near future, we'll be able to talk about this and show more data on these areas, potentially useful data to researchers. I'll say one last thing, not quite a lesson, but certainly something that we think about when we look at this graph. We could have only painted this picture all the way from October 2016, all the way to September 2021, because of the fact that from the beginning, the DNA of CPHS has been to do continuous fast frequency data collection. And in many ways, we feel that this was a very prescient choice. And that choice has really been validated in studying the last 18 months, but also other events, like, for example, demonetization. We feel we made a conscious decision that this idea of a normal year and trying to focus on those normal years was not the way to go. Instead, we should be doing continuous and fast frequency data collection. Of course, that has an implication on the way in which you conduct the survey, in the way in which the instrument is written. But staying true to that DNA is, I think, what made this picture possible and made it possible for us to communicate to a lot of people in India and abroad this sharp increase in unemployment that we saw in April, but then also the reduction that we saw by July. And so really, it's not a lesson, but it's certainly something worth thinking about, which is you cannot predict catastrophes. And the prescience that we had in having this continuous machinery is what really enabled us to be able to study everything that happened before the lockdowns, during the lockdowns, and hopefully afterwards as well. So that's it from us. Thank you very much. If you're interested in knowing more about CPHS, CPHS is the Consumer Pyramids Household Survey. My email address is at the bottom. Data from CPHS ends up in many places. One is it ends up in something called Consumer Pyramids DX, which is the record level data that researchers across the world have access to. It also shows up in the form of aggregates in two services that we have at CMI, one called Economic Outlook, another called States of India. And importantly, important indicators like the unemployment rate are made publicly available at varying frequencies, including a weekly frequency, a monthly frequency, and a 30-day trailing average, which is available for free for anybody at unemploymentinIndia.cmi.com. Thank you again for inviting us to this seminar, and we hope that we could add something valuable to this discussion. Thank you.
Great. Thank you all. It's very inspiring work shared by all four speakers. I mean, all of them captured key indicators related to impact on livelihood during pandemic and changes in livelihood during this time. I mean, at a time when data collection was really, really difficult to administer. And I really like the way everyone presented their findings to illustrate different trends and patterns at different levels of disaggregation. So that was really interesting to see. And all these presentations, the central theme remained to be the methodology of collecting employment-related indicators. So with that, I would like to open the floor for discussion. So we have many others also in the panel. So please feel free to ask your questions directly to the speakers, and those who are also attending this discussion, please feel free to post your question in the Q&A as well.
Several questions in Q&A. Perhaps we can start with that, and meanwhile, if some of the panelists, like Dr. Palla, Dr. Manna, etc., have any questions or comments, that would be most welcome. Both of them have enormous experience with employment data.
If you allow me to speak, Manna this side.
Yeah, please, Dr. Manna, go ahead.
Yeah, just two questions or rather clarifications. One relates to Sonal's presentation, where she showed the work participation rate for females during pre-pandemic period as per different sources. I see that there are huge divergences in the estimates as per the sources. So my clarification is that the figures you have quoted, do they relate to Delhi NCR region? How you could adjust it based on NSS, PLFS data and all? This is one clarification. And the second clarification to Dr. Krishnan, during pandemic, particularly April, May, June 20 and all, that period, many organizations had really the difficulty to collect data. Would you kindly clarify whether at that point of time, during that period, you had the physical interview or telephonic survey? That's all. Thank you. But anyway, congratulations to all the speakers for lively presentations. I mean, interesting, quite interesting.
Let me just take a first crack at answering Dr. Manna. Thank you. Very good questions. Dr. Manna, we actually, first of all, the data definitely relates to the Delhi NCR region. But we also have both urban and rural households, including rural areas as far away as Meerut and so on. We do not aim to replicate PLFS data. In fact, our goal was to try. We started out with the belief that we felt that NSS decline in female labor force participation was a little bit too steep to be easily believable. And we were wondering if there were different ways of asking the same questions would net higher female labor force participation rate. Okay? So that was the attempt. And instead of trying to make it representative, we were trying to compare the same individuals in same households by asking two types of questions. I'll end there and turn it over to Kaushik.
Thank you, Sonal, and thank you, Dr. Manna, for this question. The short answer to your question is that we transitioned from in-person interviews to telephonic interviews. I don't remember the exact date now for the Janta curfew, but it was either the 22nd or the 24th of March. Until that date, we had a perfect golden track record of never missing a single day in the field. We've interviewed households every single day in the field from the 1st of January 2014 into that day. When that day happened, we realized that we were entering a new phase, and we transitioned as quickly as we could from an in-person survey mechanism to a telephonic survey mechanism. We were able to do this because as a panel survey, thanks to the repeated interactions that we've had with our households, we had working active phone numbers for over 92% of the households in our sample. We took a lot of steps to make sure that the telephonic survey was conducted in a manner where the quality did not fall too much. The biggest takeaway from that, or the biggest outcome from that, is that our response rates fell, but we ensured that we kept our balance in terms of rural, urban, state-wise, income groups, etc. We transitioned back into in-person surveys wherever it was safe to do so and wherever the conditions physically allowed us to do this. We are now at this place where we transition between in-person and telephonic surveys, depending on the situation in the field. So when the second set of lockdowns rolled around, we moved back from in-person into telephonic. We are now coming out of that again, just before the event had begun. Sonal and I were chatting about this. We are very delighted about the fact that in September of this year, we were at over 99% in person. And we are hoping that there are no more lockdowns because they do pose significant challenges when it comes to conducting a survey.
Okay, thank you both. So I think, Sonal, one point that Manna was trying to make, I mean, in addition to the differences in the questions you asked, also there are geographical variation of geographical coverage, difference in geographical coverage of all these surveys you mentioned. So the female workforce participation rate that you presented in the slide, I mean, does it consider the same geographical region, or it's, I mean, as no, right? Okay, yeah.
The national.
National, yeah.
If they don't relate to the same geographical region, obviously estimates will not be strictly comparable. I think some limitation would be there. Yeah.
Yes. No, I think it was just set up there because there are 4 different surveys coming from different areas.
Mm-hmm.
PLFS kind of just gives us a base.
Okay, thanks. Thanks to both of you.
There are several questions in the chat, particularly addressed to Kaushik. I think Kaushik, with respect to attrition rate in your study.
Sure, Sonal, thank you. On attrition rate, thank you for the question, Dr. Banerjee. We are, to be very honest with you, we know attrition well. Before the lockdown, it was in the single-digit percentage points. There was not a lot of attrition from the panel. Whatever attrition there was mostly on account of the changes that were happening to India's urban geography. Villages would get turned into towns or peri-urban areas, households would get destroyed, new households would get formed. A small part of attrition, of course, is due to prolonged non-response. If a household does not respond for 3 waves of CPHS in a row, which is 1 year of data collection, then they are marked to be dropped from the survey. Once the lockdown hit, we are still waiting for the dust to settle. So we are not marking anybody as attrited yet because of the conditions in which we were operating. Response rates certainly fell. They fell because when moving to telephonic surveying, we had to get the supervisors to run the surveys rather than our field staff for a variety of reasons. I don't want to make the answer much longer than your question. It fell to about 30% in April of last year, recovered to the mid-70s, fell again to about the 60% approximately in May when the second lockdown happened, recovered again into the mid-70s. Our historical average has been in the 80 to 85% range, and we are hoping to get there unless there is another lockdown.
Okay, thank you. I think there are more questions for you, Kaushik. So one is there any regional pattern emerging from any of these surveys? So since yours is more representative at the national level, maybe answer that.
Sure, Santanu, thank you for the question. I forgot who had asked it. I want to be very clear. My role at CMI is in making sure that we produce the data and make sure it gets to researchers. We also at CMI, of course, analyze the data. But I want to be very, very clear on this. I certainly don't know too much about interstate variations. My colleague Mahesh Vyas is also here. He may know a little bit more about what's happening across state to state. We've certainly seen that there's some research happening that other people are doing using CPHS, but I don't know enough and it wouldn't be right for me to comment on that.
Same question was posed to Ankur. Ankur, do you have a sense of regional variation?
I mean, we do have data from different states, but the reason why, I don't think we can really do these interstate comparisons is the sample is very much a function of who the organization, what kind of community the organization worked with. And so in that sense, these are not comparable communities across the states. And it wouldn't be fair to do interstate comparisons with what we have currently. Going forward, when we have a sample which is sort of, been randomly selected and more and representative in that sense, we hope to be able to do these interstate comparisons.
So I think we have a couple of raised hands for speaking from attendees, but I don't.
Yeah, so Pallavi and Partha, both that. So maybe in that order, Pallavi.
Hi, so my question is directed to Rahul Lahoti, and you showed that the recovery rate amongst women, it's lower. So do you have a sense of like what type of work are those where women are preferring to stay out of the labor force? And you also mentioned that there's a significant churning in that this also includes new women, like like fresh labor market entry. So so I know this is a phone survey, and so there are limitations. But do you have insights into the type of jobs you're looking at?
Yeah, thanks for your question. So on churning women, so there is comparatively women's labor unemployment rate in our sample is quite higher as compared to men's. It's 21% as compared to in the teens for men. And we asked particularly women who left the workforce why they had left the workforce, and majority of them had mentioned that they did not have a suitable job, and most of it is from the non-agriculture sector. It's basically, it might be because men are also entering the labor force. Men might be pushing out women from the labor force. Now to your second question on transitions, in terms of there's a shift from women who were working earlier are now out of the labor force, and who were not working have come in the labor force. This we had asked in particular why women entered the labor force. And again, the major reason is that it's due to distress. Wherever households where husbands or other household members have lost employment or reduced their have seen reduction in their earnings, have seen their women have joined the labor force. So it's a distress situation. But still, it's a puzzle on as in the level of transition which happens. We have also studied using CPHS data and some of PLFS data in trying to understand whether these transitions are normal or whether this is a pandemic phenomena. We are still trying to figure that out.
So do you have a sense of, the industry, or whether these are like formal, like using the CMI data? Do you have a sense of the industries, like for non-agricultural jobs, where women are preferring to stay out, or whether wherever they're entering?
So using CMI data, no, not really. I don't have a sense using CMI data right now. It's still analysis in progress.
Okay, thanks.
Thanks, Pallavi and Rahul. And I think Partha Mukhopadhyay raised his hand before. So do you have any question, Partha?
I was just, I've loaded because I was scrolling through the Q&A box to see whether it's been answered. And I missed Sonal's presentation. But I was just checking in to understand whether there was any results relating to migrants I noticed that there was one, I think, in the one which Ankur presented, which essentially spoke about lower access of migrants to NRGA, but I don't know whether it's like significantly lower number or not, but not a substantially lower number, even at the point estimate that we provide. So both in terms of access to jobs when they went back, the safety net, as well as the return story. Do we have any anything on whether migrants have been worse affected, in the sense that one would expect in the first the zero salary people who are coming in, are they people who are in any specific sector? I think this is to Rahul's presentation about salary people with zero income. Are there any specific sectors? Is it possible that there might be sort of periodic payment of salaries, or is this a situation where they've been told that they will work, but they'll get paid their salaries later because of the cash flow issue at their employer? Do you have anything that in the data that might allow you to infer anything that might be happening? Thanks.
So just on the zero incomes question, we find that across employment categories, whether self-employed or salaried or casual workers, the percentage of zero incomes, people who say they are working but with zero incomes, have substantively increased. And we do not fully, some understanding of the data is that it's mostly because they haven't been paid for that month, whether they got paid later or not, or whether they were just working to save the job for later. It's not clear to us because we haven't re-interviewed after that.
But no pattern in the by industry structure, the rough structure.
There is.
Who might have paid lump sum later.
Yeah, there's more work on it. In PLFS also, there's a similar pattern where there is a lot of zero incomes, especially in their March to June quarter 2020 data. And the zero incomes is still a problem, but we still need to understand where it's coming from and whether those incomes will come later or they're lost.
Thanks.
We have two other hands raised. Anuja Bapat and...
Yes.
Yeah, so hello everyone, and thank you for wonderful presentations. I'm Anuja Bapat, working with Ministry of Statistics, but not on employment data. I had one question for Mr. Krishnan, because he's doing a large survey, just like the MOSPI does in most of, and we also had to do a lot of telephonic, interviews or surveys when we could not do the physical ones. And you would realize that the survey dynamics or the way responses change in two mediums, the physical and the telephone, are very different. So it would be interesting. I was just, thinking aloud that it would be interesting if we could actually have a small sample of telephonic interviews kept intact, just to, understand the way dynamics change in terms of responses. And do you plan to anyway do that? Because Ministry of Statistics primarily does physical door-to-door survey, and we have resumed in most of the cases to the physical surveys. But it was a thought that I thought I'll share with you. And the other question was what Mr. Palvi Chaudhary asked was the female participation and the anecdotal evidences. If you look at the kind of job that women were into, would be a very defining variable in terms of who was pushed back into unemployment. Because if I look at the anecdotal evidences, say particularly the example of domestic workers, so domestic workers who were migrant workers, you can actually see that, I mean, you can see things, people around you or examples around you where, since the women of the household who was employing a domestic maid lost job, in turn, the domestic maid lost her job because she was not anymore needed, because for that woman to continue with her own work, employment. And sometimes when the migrant women who were doing domestic workers job, they went back to their native places, the local women folk, as you say, the local women folk filled in their places when those migrant women were not able to come back. And that also changed the way they were being paid. The remuneration on the same very jobs they have risen sometimes, because the migrant women were actually ready to work for less. So these are some anecdotal evidences which I was just thinking about. And say, for example, Professor Sarin's survey, which he said is a purposive survey. So probably some focus survey, focus study or focus group can actually take up the issue of the way wage dynamics and the employment changes in a particular sector for women, and that can be a interesting outcome for all of us to look at. Thank you.
I can go first, and then
Sure.
I think, Rahul, there was a question for you and then a question for Professor Sarin. Ma'am, thank you. This is it's a great question, and as you were saying it, I could see Sonal also nodding, and I think everybody else on this panel probably nodding. The dynamics of a phone survey are so different from in-person surveying in terms of the kind of staff that you can use to do this kind of surveying, what it does to survey length. In some places, it increases survey length drastically because you might need to do multiple phone calls to complete the survey instrument. In other places, it might reduce it drastically because a person can just answer while maybe they're doing some other things on the site or something like that. As I forget whether it was Sonal now or Rahul that
and the quality of response also, Professor Krishnan, changes drastically. The way people respond to when you go to a household and the respondent is surrounded by his kids and kins, and there is a social prestige, there is a facade to be kept, there is a the kind of responses you get also vary very differently. You can actually get away with a very different response when you are answering telephonically.
Absolutely. And I think that was what Rahul was saying when he mentioned how there was an anecdote of you can hear someone else in the family almost prompting an answer when it's being done through a phone survey. So for us, it's certainly very critical that we can get back into in-person surveying. That is definitely the better mode of surveying for us, despite the cost implications, etc. But ma'am, the point that you raised, which is there a way to somehow systematically understand the benefits as well as the drawbacks of a phone survey compared to an in-person survey by maybe doing this on a small part of the sample? That's not something we're doing at the moment, but it's a very interesting idea, and we'd love to discuss it further with you offline. At the moment, we're not doing anything like that. For now, our aim is very much to get back into in-person surveying 100% to the extent that we can.
Thank you.
Thanks for the question. Just on the women's labor force participation, I agree that there are types of jobs, as you mentioned, might be lost, which women were earlier doing. In addition, though, based on our data, there is a lot of people, men and women, who were out of the labor force who are joining the labor force as distress labor. And it is possible that men are pushing out women. So women's unemployment rates are higher in our sample at least. And the reason being, men are generally preferred for various reasons because of their flexibility in terms of working hours or other aspects. So that is also an issue with women's labor, with labor markets there. Yeah, thank you.
Professor Sarin, yeah, I'd like to add.
Our survey so far has asked these questions more at the household level, saying, has there been somebody who's lost a job? But going forward, we are going to be tracking individuals separately. So we are going to be asking their independent incomes, whether they're employed, and hopefully we'll be able to track that going forward. But just on the issue of phone surveys and face-to-face surveys, we'd also been doing phone surveys in Ahmedabad, just as the lockdown began. And the primary purpose of those surveys was to again find out whether people have lost jobs. And
sorry.
And then we were to, and these were being conducted by volunteers to identify people who also needed help. So who might be more vulnerable. And now these were essentially households who we had done face-to-face surveys in 2016. And so we had basic household data on them and socioeconomic characteristics. Now, what we correlated those who were found to be needing help with that data. And we find that it worked fairly well in terms of, so households with less educated, households without sort of having pakka, without pakka households, etc. They came out to be also identified as more vulnerable in the phone survey. So this is not exactly what you are asking or what we're discussing, but I thought this was sort of interesting to at least share, because that over the phone also we were able to identify quote unquote households that would have been identified as vulnerable in a face-to-face survey with more objective data.
Thank you.
Yeah, I completely agree that you miss the whole context that you get in face-to-face survey as opposed to on phone surveys.
I think particularly the case for conversational questions where, there is a lot of two-way sort of understanding.
Yes.
And that might affect actually employment questions if they are more conversationally given.
Yes. Okay, so I think we already 5 minutes past our timeline of 8 o'clock. So I'd like to thank again all our speakers for very interesting presentation and very inspiring work, and also answering all the questions. So thank you all and have a good night.